STAT is a series of game-based simulations which challenge critical thinking skills of medical practitioners from novice to highly skilled. These serious games feature detailed virtual patient physiology, appearance, and behaviors to support treatment of trauma throughout the continuum of care. STAT provides an infinite number of outcomes. In fact, 15 minutes of gameplay can translate into many hours of training, resulting in improved outcomes and a higher return on investment.
You are the emergency medicine physician, working in the ER of an eMeds Plus 10 facility located in Kandahar, Afghanistan. You are working with an operating room nurse, 2 technicians, a cardiopulmonary tech, and 4 alpha administrative techs or recorders. You currently have no patients in the ER, but an urgent medevac helo has just arrived, which has transported 4 casualties who were operating in a nearby convoy patrol and was hit by an IED. The casualties have been removed from the helo, and the flight surgeon at your facility has triaged them. All casualties are immediate priority and were assigned specific priority according to bed. That is, the first priority is in bed 1, and the 4th being bed 4. Your job is to re-triage the casualties, resuscitate and stabilize them, and determine their disposition. You can ask your techs for each patient's history, or immediately begin assessments or procedures on any patient.
We start at bed 1.
I'm in a lot of pain. Will someone help me?
To look around, I just click and drag. And to perform a procedure, I just highlight a body part, select from the context-sensitive menu, and assign it to someone.
Need to get a good look at him, so remove all his clothing.
Exposing the patient.
Really
The
hurts.
patient is splinting, complaining of chest pain, has a bad bruise. Press 2 to jump to bed 2. Let's expose this patient.
Need to get a good look at him, so remove all his clothing.
Exposing the patient.
Patient is unconscious and has an active arterial bleed with pooling blood on the litter and the floor. So let's get a fresh tourniquet applied. Assign that to Tech 2.
He needs a tourniquet applied above his right tib fib fracture and open arterial bleed.
Got it.
Looks like the bleeding is under control now, so press 3 to jump to bed 3. Expose this patient.
Need to get a good look at him, so remove all his clothing.
Exposing the patient.
Patient is wheezing and has bad burns over all their extremities. Press 4 to jump to bed 4. The stats on this patient are relatively stable, so let's concentrate on the first 3 for now. I want to get all of them on wall oxygen. I do this by clicking the mask, hook to wall oxygen, assign it to someone.
Hook him to wall oxygen, 100% non-rebreather mask.
Roger that.
Same thing for bed 2, mask, hook to wall oxygen, assign it to attack.
Hook him to wall oxygen, 100% non-rebreather mask.
Roger that.
And same thing for patient 3.
Hook him to
My
wall
chest
oxygen, 100%
really hurts.
non-rebreather
Procedure
mask.
takes.
Could someone
Roger
help
that.
When the
me?
procedure's done,
Please?
the oxygen line will fall to the floor to let me know that it's completed. I also want to get all these patients on fluids. I do that by clicking their arm. Infuse via large bore IV, 2 liters of fluid. Assign it to a
Get
tech.
2 liters of crystalloid started via 2 large bore IVs at a wide open rate.
We're starting the
Really
IVs.
hurts.
Same thing for bed 2. Infuse via large bore IV, 2 liters of fluid.
Get 2 liters of crystalloid started via 2 large bore IVs at a wide open rate.
We're starting the IVs.
Now patient 3, I'm going to have a hard time inserting an IV into his arm because he's too badly burned. So let's order a central line.
Insert a femoral central line.
I'm starting the femoral central line.
And infuse fluid via the central line.
Give him 2 liters of crystalloid via a central line.
I'm starting the crystalloid via the femoral central line.
Now let me work my way back to patient 1, who's my highest triage patient, but let me stop at patient 2 for a second. Lost a lot of blood, so let me get some blood ordered. Order blood, 2 units uncross-matched.
He needs 2 units of type O negative or type-specific uncross-matched blood.
I'll have that blood to you in 5 minutes.
And I can order a central line for him as well.
Insert a femoral central line on the left.
I'm starting the femoral central line on the left.
All right, now we can get back to patient 1, see what's going on with his breathing. Let's listen to his breath sounds, something the doctor does.
I have lots of chest pain. Can someone help me?
I understand that you're in a lot of pain. I'm here to help.
Thanks, Doc.
I'm going to listen to your chest.
Breath sounds are nice and loud on the far side, but weak on the near side.
Bed 1 is complaining of left-sided chest pain. He has a patent airway. He has decreased breath sounds on the left and is splinting.
With decreased breath sounds but a patent airway, I know I'm going to have to order a chest tube tray for this patient. So let's get that ordered.
Get a chest tube tray for bed 1.
You'll have it shortly.
It's going to take another 20 seconds for it to arrive. So let's jump over to bed 3 and see why he's wheezing so bad. Let's check his mouth.
I'm going to remove your mask and take a look in your mouth. Bed 3 has soot around his mouth and nares and inside his mask from expectorated sputum. He has carbonaceous material
Doctor, the
in
chest
his
tube
oral
tray
cavity,
for bed 1 is
tongue
ready.
erythema, and black sputum in his oral cavity.
So it sounds like he's inhaled a lot of burning material and his throat is swelling up, so I better intubate this patient. Before doing that, I should sedate him. And that's something the nurse does.
Give him a sedative and a paralytic.
Giving him the sedative and paralytic.
And while waiting for that to take effect, I can have patient 1 cleaned and anesthetized for that chest tube procedure.
Bed 1 needs a chest tube, so clean and locally anesthetize the area.
Prepping him.
And now let's intubate this patient. Insert the ET tube.
I'm going to slide this tube in so that you can breathe better. Hang in there with me. Maybe a little uncomfortable at first, but shouldn't be painful and it will help.
You'll notice that you can hear the Propax on all of the patients. The rate of the beeping indicates their heart rate, and the tone indicates their O2 saturation. And as you perform procedures, their stats will improve or decline depending on the procedures you perform. Now that that ET tube is in, I need to get it taped and ventilated.
Secure his ET tube and hook him to a ventilator on 100%
And
FiO2.
hopefully you'll see
Yes,
his
doctor.
O2 saturation improve now that I've performed that procedure. So let's get back over to patient 1 and get that chest tube inserted.
Now you're going to feel some pressure. Hang in there and you'll be breathing better soon.
Are you sure, Doc? I'm pretty scared.
You're doing fine. Bed 1's got palpable extrathoracic viscera, and I'm putting the chest tube in nice and gently. And I've got 500 cc's of blood return. I hope that feels a little better.
A little, Doc. Thank you.
So it sounds like this patient has a diaphragmatic rupture. Some of his intestines have ruptured into his chest cavity, and because I got blood return when I inserted that chest tube. So I should order some blood for this patient.
He needs 2 units of type O negative or type-specific uncross-matched blood.
I'll have that blood to you in 5 minutes.
And let's get a central line order for this patient as well.
Insert a femoral central line.
I'm starting the femoral central line.
Now I can hear from one of my patients that he's begun to snore. And his blood has arrived. So let's first get that blood going.
Give him 2 units of blood via the central line.
I'm infusing the blood via the central line.
And now let's get a nasal pharyngeal airway in, so see if we can clear up his airway.
Bed 2 needs a nasopharyngeal airway.
Roger.
His O2 saturation is dropping pretty low because of his tongue is blocking his air passage. Hopefully that improves when we get this nasal pharyngeal airway in. He just started to alarm because his O2 saturation was dropping too low, but now that airway in, his O2 saturation is good, and it sounds like the snoring has stopped. Getting back to patient 1, I can assess his GCS score by clicking his head.
What is your name and where are you from?
Michael Green, sir. From Boise, Idaho.
Can you wiggle your fingers and toes?
Yes.
Bed 1 is spontaneously opening his eyes, is oriented, and is following motor commands, with a GCS score of 15.
If I jump over to bed 2 and assess his GCS score, I would expect it would be quite different.
Hello, are you awake? Patient is comatose with a GCS score of 3.
So I suspect he has some intracranial pressure building, so I want to administer some mannitol. Let's have the nurse do that.
Give bed 2 mannitol.
I'll get and administer the mannitol.
And now let me jump back to patient 1 and continue on with his secondary survey. Can do things like checking his mouth.
Going to lift your mask so I can check your mouth. Open wide. Bite down. No problems with his tongue or mandible, and no edema, deformities, or lacerations appreciated.
Can also check his pupillary response.
I'm going to take a look into your eyes. His pupils are equal and reactive.
Let's palpate his chest.
Going to feel your chest.
Okay. That really hurts, Doc.
Sorry, I'm almost done feeling your chest. He's got tenderness on anterior and lateral compression of the left chest. I also appreciate crepitus.
Can also palpate his abdomen.
I'm going to feel your abdomen.